Thanks, Devin. And at some point, we have all developed stomach aches, but did you ever think about the cause? Here to help us undigest some abdominal pain is Nurse Christina Paris. Thanks for joining us this morning.
Hi, good morning. I'm glad to be here.
Yeah, definitely. So, a lot of people suffer from abdominal pain or chest pain or stomach pain. What are some of the most common causes, or what are some of the causes?
Yeah, absolutely. So when we talk about abdominal pain, we're kind of just talking about this area here in the belly. And our digestive system, we have lots of acids and things that help break down food, and so those can cause some abdominal discomfort. Also, sometimes our belly will send signals to our brain. So our belly and our brain talk quite a bit. In fact, our fight or flight when we're in that fight or flight, sometimes our digestive system will actually slow down so that blood can get pumped to different parts of our body, more vital organs that are needed. So there's a lot of communication between the brain and the belly, and sometimes abdominal pain is just due to nerve damage. And so those are the hard ones, because if that happens, it's because there's no cause. They can't really determine what's going on, unfortunately. There's acute belly pain and chronic belly pain. So acute can be something like norovirus. You get a stomach flu. And then chronic can be due to more chronic conditions like that nerve damage. But things like appendicitis, that's a little pouch off the large intestines, and that can get infected. We have diverticuli. Some people have little pockets inside their intestines, and if those get infected, you can develop diverticulitis. Sometimes kidney stones, because that's sort of in the back, but it can also feel like, in the stomach or the bladder area can feel, you can have stones there, and so that can cause abdominal pain. Sometimes with women, if you have an ectopic pregnancy, so that's a pregnancy outside the uterus, can cause abdominal pain, or even ovarian cysts, so those can be very painful. That's just a small sampling of all the things that can happen and can cause abdominal pain.
Yeah, so is there a type of test or treatment that people can do to test for abdominal pain?
Yes, absolutely. So typically, you'll go to your doctor, they'll do a physical exam. They'll kind of press around and see if they can sort of find a region, and determining which, what location the pain is, that can kind of help narrow things down as well. Some people have peptic ulcers too, and those can cause a lot of discomfort. But you can do blood tests, you can do CT scans, MRIs. Sometimes they'll do what they call an upper GI, where they'll stick the tube down and look at the upper part of your GI tract and see what's going on.
Yeah, definitely. And, kind of mentioned for adults, but what about for children? What should they, or what should parents know?
Right, absolutely. So with the kiddos, definitely if they've got the nausea, the vomiting, or the diarrhea, we want to keep them hydrated. Some kids have a lot of constipation issues, so depending on what they're getting fed. So we want to make sure kids have a lot of good fiber. And if your child does have problems with constipation, you can try things like apple juice, prune juice, pear juice, things like that can help increase their fiber intake with vegetables and salads if they like or will eat salads. Those are a good source of fiber too. But if you're going to treat with medications, make sure you talk with your doctor first. And I skipped that. I know you did ask me about treatments. So we do antacids, and then there's PPIs. Those are proton pump inhibitors. So some of them reduce the acid buildup in our body, and some of them actually prevent it from occurring. So when you're taking the things like Nexium, Prilosec, those can take time to develop. So you want to make sure that you take those on an empty stomach, because it can take 60 to 90 minutes, and some of them even take days. proton, it's the proton pump inhibitors can take days, yeah. And then, so if you have a child, make sure you talk to your doctor before you're gonna give them anything like Tums or Prilosec or things like that. Now, if your child's bellyache gets really painful, you wanna call your doctor. Call your doctor if it's just not improving after a couple of days, if they develop a fever, if you're noticing urine is really dark brown or red, if your child is vomiting black vomit or dark, anything that looks like coffee grounds, red or yellow, you want to call your child's doctor. And if they're less active, that's always a big sign with kiddos that are sick, if they're just really lethargic. So you want to make sure you're following up on those kind of things. So.
Awesome, great. Well, I'm glad people can be more informed at home about how to, kind of treat their different types of abdominal pain that they might be experiencing.
Yeah, of course, always go and see your doctor. If you have abdominal pain, they can help you out, help you figure it out and maybe get a treatment.
Awesome, awesome. Thanks for joining us this morning.
Glad to be here.
Awesome.